I'm your host, Anika Ward, and welcome to season one of Coronavirus Watch. So, today we'll be speaking to four nurses from around the Caribbean that are on the front line fighting this pandemic. The first nurse we'll be speaking to is Miss Kadesh Morgan from the Queen Elizabeth Hospital in Barbados. Miss Morgan, please, can you educate the public about what is coronavirus?
Hello, and thank you for having me, Miss Ward. I'm Nurse Morgan from Queen Elizabeth Hospital in Barbados. So, to begin, the coronaviruses are a large group of enveloped RNA viruses known to cause diseases in birds and mammals. In humans, it causes severe respiratory tract illnesses. The coronavirus was named as such because of its crown shape. The COVID-19 disease now afflicting the world is a new form of the virus found in Wuhan, China, December 2019. Coronaviruses consist of severe acute respiratory syndrome coronavirus, SARS, Middle East respiratory syndrome coronavirus, MERS, and coronavirus 19. COVID-19 is caused by a new form of the SARS virus called SARS-CoV-2. The World Health Organization has already isolated the virus from infected patients. Since coronavirus is a respiratory illness, it mainly affects the organs in the respiratory system, although it can cross the mucous membranes from the nose to the rectum and also affect the gastrointestinal system. Symptoms of infection usually appear 2 to 14 days after being exposed to the virus. These symptoms and signs include fever or chills, coughs, colds, runny nose, muscle aches, diarrhea. Although some patients show no symptoms and are considered to be asymptomatic, they are still able to spread the disease from person to person. Illnesses commonly mistaken for coronavirus include pneumonia, cold or flu, allergies, and strep. The elderly and those with underlying sicknesses such as diabetes, obesity, smoking, hypertension, etc., are more at risk due to their weakened immune systems.
Thank you so much, Nurse Kadesh Morgan. Now we're going to move on to our next speaker, and that is Nurse Nikisha Brooks from the Belmont Hospital in Trinidad and Tobago. So, Miss Brooks, welcome. Please educate our public about how the coronavirus is transmitted and its portal of entry and exit.
Hi everyone, my name is Nurse Nikisha Brooks from Belmont Hospital in Trinidad and Tobago. Thanks for having me today. Coronavirus can be easily transmitted by different means. In order for us to lessen the spread of this virus, it is very important to know how it is transmitted so we can take the necessary precautions. The virus can enter the body of the host through the same routes it exited. For example, when an infected person sneezes, it leaves the nose of that person and enter through another person's nose. Cells in the nose, the throat, the cornea of the eyes, and the lining of the intestines are found to have genes encoding proteins that the virus uses to enter the body. So we can say that this is an entry point. How it is transmitted. First, we're going to be looking at person to person, and there are several ways that this can happen. The first one we'll be looking at is droplets and aerosols. Now, this is when an infected person sneezes or coughs, and tiny droplet from their nose or mouth is left in the air, so other people can become infected. The next one is airborne transmission. Now, it is said that the virus can live in the air for 2 to 3 hours after an infected person has sneezed or coughed. So even after that person left the area, other persons can still get infected by inhaling the air. The next one we'll be looking at is surface transmission. When an infected person touches frequently used surfaces such as doorknobs and countertops, they contaminate these areas. So the virus can be easily spread by this means, as other people are using these areas frequently. So they will touch these areas, then touch their eyes or mouth. The next one we'll be looking at is the fecal route. It is said if an infected person uses the toilets and does not practice proper hand hygiene, then they could contaminate surfaces. However, more studies have to be done to confirm this. The next one we'll be looking at is community spread. Community spread occurs when an infected person cannot relate to coming in contact with another infected person. So we can see that the virus has now reached community spread transmission. The next one is pets and COVID. Some pets were tested positive for coronavirus, but there is no proof that these pets have spread the virus to humans. But the pets that had tested positive for this virus had contracted it from humans.
Thank you, Miss Nikisha Brooks. And now we're going to speak to another nurse, Miss Danica Chambers from the Mandeville Regional Hospital in Jamaica. So, Miss Chambers, explain to us, what are some of the treatments that are available for patients with COVID-19? What are some of the tests that are done to detect if a person has COVID-19? And also educate us on how persons can avoid contracting COVID-19.
Hello everyone, and thank you for having me, Miss Ward. So, there is this saying in Jamaica that goes, prevention is better than cure. So, we should all try to prevent ourselves from contracting the coronavirus by using these simple guidelines. Guidelines include cleaning hands with alcohol-based hand rub. This alcohol-based hand rub should be at least 70% alcohol, or washing hands frequently and thoroughly with soap and water. Also try to avoid crowds as much as possible, but just in case you have to go near to someone, you should maintain a social distance of at least 1 meter. Persons should also try to avoid touching the eyes, nose, and mouth, and ensure to cough or sneeze in a bent elbow or in a tissue. Frequently such surfaces should be cleaned and disinfected regularly. Rooms should be kept ventilated. No mask, no pass. Dealing with the COVID-19 pandemic. The wearing of a mask is very important in preventing the contraction of COVID-19, since the mask helps to block droplets from the nose and the mouth. At this moment, there are no specific treatments for coronavirus, but investigators use treatments which include the antiviral drug remdesivir, which is used to treat hospitalized COVID patients ages 12 and over. Rheumatoid arthritis medication baricitinib is also used in some COVID-19 cases. Oxygen or mechanical ventilation is used in severe cases of corona hospitalized patients. Testing for COVID-19. So there are several ways to test for COVID-19, but I will be discussing 3. The diagnostic test, which is in the form of a PCR test. This one uses a nasal swab, which is inserted into the nasal cavity to collect cells and fluids from the respiratory system. This test identifies the specific gene for SARS-CoV-2. The antigen test is done with a nasal or throat swab, and it looks for a protein of COVID-19. This test might be cheaper, but not very accurate, as a person in their initial stage of the virus may come up as COVID-19 negative when they are actually COVID positive. Then you also have the antigen test, which is a form of serology test. This uses a blood sample and it identifies past infections of the virus and looks for the body's immune response to the virus.
Thank you so much, Ms. Danica Chambers. Now we're going to move to the last speaker of the night, and that is Mr. David Thompson from the Grand Cayman Hospital in the Cayman Islands. Welcome, Mr. Thompson. Please educate us on the role of nurses in treating the COVID-19 virus.
Thank you, Ms. Ward, for having me. Nurses constitute majority of the healthcare providers. Therefore, we play a critical part in the healthcare systems. As professionals, we are known as the frontline heroes. As nurses, we become friends to our patients. We offer advice, counseling, support, and encouragement, because encouragement do help in the mental care. Now, there are many roles that we nurses carry out on a daily basis, but I'm just going to highlight a few roles that we carry out in this COVID pandemic. These are detecting signs and symptoms of the virus. Also, provide treatments. Although there aren't any treatment as yet, but we offer medical care to them. We don't only do that, we assist our patient to see how well they are responding to the medications. And also, we educate our patient. We just don't leave them as that, like that. And also, we teaching them about proper and washing techniques. And also, the proper wear of facial mask. Many of times we have seen person wearing the mask on the forehead, on the chin, but the proper way is to wear it properly over the nose and mouth, and is properly fit beyond the ears, because your care, your health is your responsibility.
Thank you so much, Mr. David Thompson. Now, we also want to say thank you to all our guest speakers. Now, we have a few tips for our nurses. Number one, always be prepared for a pandemic. We know that nurses make up a large proportion of the healthcare system, and their functions are very important and crucial, and so they must always be prepared. Number two, you have to remember that as a nurse, your responsibility is not only to your patients, but also to yourselves. We know that we all work best under pressure, but under extreme pressure, it can lead to tiredness and irritability and decrease your performance at work. Thirdly, nursing should not only be a source of income, but should be considered as a great responsibility, as people's lives are in your hands. And finally, being a nurse is very rewarding, as you not only get to improve the life of others, but also save their lives. Thank you everyone for watching. Have a wonderful night. Bye-bye.